Good evening, everybody, and thanks for coming along this evening for what should be a really exciting discussion on this complex and probably not enough discussed area of state-of-the-art in complex cutaneous SCC. My name's David Gyorki. I'm a surgeon here at Peter Mac as well as at the Austin, and I'm the Research and Education Lead in Skin and Melanoma at the VTripleC. And I'd like to start by acknowledging the traditional owners of the land in which this event is taking place, the land of the Wurundjeri people of the Kulin Nation, and we pay our respects to their elders and family, past and present. So, for those of you a little unclear on what's happening today, I'll just start off by giving a little bit of an introduction on the VTripleC, on the purpose of this evening, and on where I hope we will get to in the next few hours. So the VTripleC is actually quite a confusing term for a lot of people because the term was used to describe both a building and a concept. The way that it applies now and to this group is that it describes this collaboration between 10 partner institutions, including the Peter Mac, the Royal Melbourne, the University, the Women's Hospital, WeHi, the Children's, Western, St Vincent's, the Austin, and the Murdoch Children's Research Institute. So many of you are probably affiliated with one of them, or many, or more than one of them, but you may not be. But essentially the idea is to bring together the various talents within these institutions to try and drive research and education in cancer forward. And I've been in this role as the Research Education Lead in Skin and Melanoma for a bit over 6 months. And what I did initially was to go out to a number of these places and talk to people involved in the care of patients with skin cancer and melanoma. And something that came up over and over again was the management of patients with complex cutaneous SCC, which is, people talk about melanoma as being Australia's cancer. I think this is really Australia's cancer because this is an area that is certainly seen widely. It's under research, it's poorly understood, and I think we have a real opportunity to try and drive research in this area going forward to better understand this disease. And certainly that's one of the main aims of today. So let me just bring up my slides. So why are we here? We've been through this. So this is the process that happened behind this symposium. I went and spoke to a whole bunch of people. We established a special interest group, and some of the members of that group are here. And we talked about what the various people in that from various institutions are doing, and decided that the best way to proceed would be to hold a workshop, which is what we're doing today, and to try and bring out the various aspects of research and treatment in cutaneous SCC around the various institutions. And then beyond today, we'll get to where I hope things will move to. So the objectives are to bring people together, and clearly it's great to see a great big turnout today. So there's clearly interest in this area. There are people here from diverse backgrounds, and actually you'll see in the program that between 7 and 7:30 there's a break. The idea there is for people to chat to others who you may not know, to people with complementary interests, to try and work on bringing together collaborations going forward. I think what we'll certainly hear is highlight of the state of the art across the precinct in this disease, and then to look at ways to collaborate in patient care and research in the future. So I just thought that this was a helpful slide to put up because it contrasts the AJCC staging 8th edition in melanoma and cutaneous SCC. So the 8th edition of the melanoma staging, which was published last year, is a really incredible evidence-based system. So Jeff Gershenwald from the MD Anderson developed a prospectively collected database from multiple sites around the world with 46,000 patients in it. About 2,500 of those patients are from the Melbourne Melanoma Project. And you can see here, this is just patients with node-positive disease. There's really wide separation of these curves between N1, N2, and N3 disease. This represents about 5,000 patients. And it really shows the power of using big data sets with high-quality data to help determine the prognosis of our patients. By contrast, this is data from Sydney, where they plugged about 500 patients with cutaneous head and neck SCC with nodal metastasis into the 8th edition SCC staging system. And you can see that it's all over the place. The patients with N2 disease do better than the patients with N1 disease. And the reason is that it's the same staging system that's used for non-cutaneous SCC of the head and neck. Essentially, it's a useless system in this disease process. And so developing some sort of prospective data collection tool which would allow us to understand this disease better certainly could have a ready impact on our patients. I'll just talk a little bit more about melanoma because this is, I think, a model that we would well be advised to look at for treating this disease. So the Melbourne Melanoma Project, which many of you are familiar with, is a very successful collaborative. It was established in 2008. Patients have been recruited since 2010. There's about 2,500 patients in the MMP. This includes the collection of prospective annotated clinical data, includes biospecimens, both tumour, serum, peripheral blood, and it's been successfully run with over $8 million in competitive research funding from the VCA. It's resulted in over 100 peer-reviewed publications, many hundreds of presentations, and like I said before, a large proportion of those patients have contributed to the most recent AJCC staging system. So it's something to keep in your mind as we go through, could we develop some way to do something similar in complex cutaneous SCC? So these are the things I want you to think about as you hear the talks today. I'm not going to take up too much more of your time. What would improved collaboration look like? Is there a role for pooled data collection? What about collaborative clinical trials? In what disciplines should those trials be done? What are the priorities? Follow-up guidelines. There's not a lot of evidence on how these patients should be followed up, and hopefully some of the various views on this will come across in the case presentations later on this evening. And I think something that you should all think about is what contribution are you prepared to make? This is not primarily designed as a lecture series, although we will hear from some excellent speakers. There's short talks, there's time for questions, and then there's the halftime break for discussion. It's designed to introduce concepts. It's designed to make you think about things that you've not really thought about before, particularly with regards to collaboration. And I want it to, in some way, leverage the high patient volume in this rare disease type to improve our understanding of biology and management.